Hey, and again, why are there so many books and calculators in here?
Okay, I've taken your advice, Dan, and I've deep dove into all things budget. With the Manitoba budget 2 weeks ago and the federal budget this week, I've been researching, calculating, and even memorizing all the numbers. And I think I finally figured it out once and for all.
Well, what have you figured out?
Okay, budgets are political. They aren't really about painting an accurate financial picture, but highlighting the good areas while covering up the bad areas in society. Well, that is until elections come up, and then when it's almost as if governments make it look like they give everybody something and everything all at once. I've done the math, Dan, and governments use budgets to try to get reelected.
Uh, and again, listen,
No, no, don't try to convince me. Okay, take for example this new capital gains
Oh
tax
no,
increase.
I've created a monster, a
Regulated.
budget
Right now,
monster.
only
What am
50%
I
of
supposed
capital
to do
gains tax
now?
the
I mean,
person
I
who
love
makes
talking about all
household
things
items
budgets and analyzing the politics of budgets, but even I'm starting to wonder if people are still going to be interested in all this. Like, can we ever do too much budget talk?
Dan,
Adam,
yes.
what are you doing in my internal monologue?
Don't think too much about it. You're right, though, this has gone on for far too long. And I think I've got an idea for how to solve it.
$100,000, two-thirds would be taxable.
Guys,
what?
the Jets made the playoffs.
The Winnipeg Free Press proudly presents, in partnership with CJNU 93.7 FM, Nigan and the Lone Ranger. Here are your hosts, Nigan Sinclair and Dan the Lone Ranger Lett.
Welcome again to the Negon and the Lone Ranger podcast,
Budget part two.
federal budget edition, which is, we've had some fun in the opening the last couple of episodes about my obsession with all things budget and Nigan's more healthy attitude, which is budget, meh. But are you actually genuinely becoming more interested in the in the hard underbelly or the soft underbelly hard numbers of the budget?
Well, be honest that, most times when I've looked at budgets in the past have been usually because I'm going on some kind of comment show or I'm going on some kind of commentary or some sort of thing that we're talking about elements of the budget. So usually I study a very specific part of the budget, and it's usually related to Indigenous communities. But this time around, and I think that most markedly because this budget is so political, it's been really hard not to sort of see that everything in the budget came out for months, so we've had a long time to sit with it in the federal. And the second is that there's some very interesting aspects of this budget that are tricky, and I think that can look in a particular way, but are complicated. And I think the capital gains increase is one of those things because it's now been sort of the frame of the government is that they're going to tax the rich, or they're going to ask those, the big tagline is ask those who are making more or making more profit to pay a little bit more. And that's
Mhm.
that phrase that Christian Freeland is talking about. So I mean, that alone is worth just digging into of whether that's true.
Well, I mean, I think it's funny because of course, I wrote about this following the release of the federal budget this week, and that means I've been getting bombarded with emails from people who are, talking about what a horrible measure this is. The fact is that we are not like overtaxed in Canada. I know that's in and of itself, I may get lots of nasty comments, you know, but like we are taxed, and no taxation system is 100% fair. In fact, I often believe that the goal of government should be to try and make the tax system the least amount of unfair to the most number of people. So, you saw that in the provincial budget. You saw an effort to do that when the government clawed back the basic personal amount, the amount of money that we're all allowed to earn before we pay any tax. So if you make, I think it's over $200,000 a year, they start to claw that back. And then by the time you report $400,000 in income, you no longer you have to pay tax on every dollar that you earn, and that is a tax fairness measure. It was very clever, both fiscally and politically, because some people kicked up a fuss about it, but it just like that part of the budget just kind of washed through the public debate without drawing a lot of attention. The capital gains, on the other hand, um, they're mostly going after people who have a lot of investment income, like so they have a lot of investment assets, and they are part of every year they're selling some of those assets to fund their life somehow.
Yeah,
Yeah.
I mean, the impact of this on certain industries is going to, I think, be the legacy of this, the legacy of the capital gains increase, because by increasing the amount of tax that's paid on over 250,000 from selling an appreciated value of something, so like a cottage or I guess any kind of investment, you're then paying more tax, and it may be the impact on, let's say, doctors who come to Manitoba who see, or come to Canada who see, oh, I'm going to pay more on these large ticket items that I'm going to be selling or buying every year. And so a friend of mine said on hearing this capital gains increase that it also will impact elements of the middle class who are doing very well in certain industries. And so therefore will kind of be not stuck per se. I mean,
Right.
we're talking about people who are in a wealthy position. But this is really an interesting appeal politically for the federal Liberals to turn towards people who are in the middle class and below. And it's almost as if they put their chips in the middle on that group of people, and that the higher income earners who are going to be not happy, and they haven't been happy about this capital gain. And that includes seniors, who are a big constituency amongst the Liberals. It's in the federal voting polling, seniors tend to support Liberals more oftentimes in the past two federal elections. Now it's almost as if the Liberals have given up on that crew, because that crew is the ones who are selling, are liquidating their property investments, and probably in the position of having to pay more capital gains as a result.
So I'm going to offer an alternative perspective. It's nice when we politely disagree every once in a while on the podcast,
Just once.
Yeah. So the people who are most affected by this, first of all, small business owners have a lifetime $1.25 million shield. So they're allowed to make that much money on the sale of a business, and without having to pay the higher capital gains taxation. Principal residences are still protected. So as long as you are in the house that you are living in, if that's appreciated wildly and you sell it for a huge windfall, that's also protected. I think that people who are selling investment assets or large physical assets that are not their principal residence, those people are in a higher income group for the most part. So that it's and the other thing is too, and this is what I don't understand, is that and I could be wrong. This is an open invitation for listeners who know that I'm wrong to contact me and tell me that I'm wrong. But like often doctors and dentists and other people that operate a business, like a walk-in clinic or a medical clinic, something like that, will talk about how selling those businesses, now they have to pay more tax on it, and about how unfair that is, because this is how they save for their retirement.
It's usually corporate entities tied up with corporate entities.
Yeah.
And corporate entities,
So
all corporately owned property there'll be no exemption. So.
No, that's correct. But here's the thing, right? Like, as somebody who I won't have $250,000 worth of retirement income assets to sell every year, right? And and I have a pension. You probably belong to a pension plan. We pay tax on all of that. So like it's important to remember that although the tax rates may be considerably higher, they're higher in relation to the value of what you're getting when you sell these assets, which in some cases can be extraordinary. Now, the interesting story, and it's particularly relevant here in Manitoba, where a lot of families own cottages. So, your parents or your grandparents, you know, uh, built a cottage and then it gets passed down through the generations. And so a genuinely awkward situation is created when one of these cottages falls into the hands of, let's say, one sibling or a group of siblings. Parents have decided to pass the title on, or they've died and the title gets passed. Okay, so there could be a considerable financial penalty that needs to be paid to allow that cottage to be passed on. And it's not, so I would sort of say that I'm sympathetic but not empathetic with the situation. Cottages are a really important part of some families. I don't like the idea necessarily of people being financially penalized for taking title to something that they has been part of, like they've had,
Family
you know,
generation.
yeah, in a symbolic way, they've been owners of the property for a very long time. On the other hand, too, what we're talking about is whether it should go tax-free to as an asset to the families or not. Because let's face it, there are just as many families, and you know from listening to friends, there's just as many families that, like, when the parents are dead, they sell the cottage, and the cottage becomes like a huge financial windfall. So I don't know if you can have a cottage exemption. That sounds very bourgeois in my but yeah, but I do. It is a real issue. I'm just not sure if it is as much of an issue as some people make it out to be. This is like, honestly, and I'm going to reference a column by a really, really great columnist in the Globe and Mail named Tony Keller. If you really want kind of a sober analysis of tax policy. Tony Keller in the Globe and Mail is a really great source. We would have him on the podcast if the Globe and Mail allowed their reporters to do podcasts for other news organizations, but they don't. So, but anyways, he wrote a column on Thursday of this week, which would make that April 18th. That is really worth reading, even as a point of discussion, where he basically says the capital gains change was way overdue. It was way overdue. And then he goes through and he mentions other things, like, tax changes that should be that really should be done if we're trying to make the tax system fair. That OAS, the old age security, should be clawed back more quickly and earlier, depending on your overall retirement income. Right now, you don't start to see a clawback until your net income is $91,000. And then it isn't fully clawed back to 100 until you reach $148,000. Like that, though, those are pretty robust retirement income numbers. So, and I completely agree. He said that we should end the capital gains exemption for principal residences. And I do, in general, agree. Although I would like that policy not to come into effect until after I sell my house.
That's right. The
So,
is,
yeah.
I mean, you've just proven yet again of the kind of intricacies and deepness of the different elements of budget, and really the justness of budget. Do you think that this is going to play out politically, though? And that's what I was really talking about, because I'm not here to defend those who are wealthy, own property, and then therefore have to pay more tax when they sell it if it's not their principal residence. I mean, if you were to sort of say, I think that plays generally well, it plays generally well into the supply and confidence agreement with the NDP. It certainly, this is the last budget that the federal Liberals really are going to guarantee passing, because the supply and confidence agreement ends this fall. Then every point at that point will be sort of a negotiation. It certainly leads a path to next year's election. But
Mhm.
politically, like I want to know how
Mhm.
politically you're thinking this is going to play out, because I mean the whole thing's about affordability now. Everybody, that's all anyone's talking about, and particularly when it came to the other big ticket item of the budget, which is housing and the investments in housing. And
Mhm.
then you get Danielle Smith coming out for the past week and various other premiers, but generally Danielle Smith, sort of evoking the Quebec clause, saying any money that comes into this province has to go through my hands, which is probably the silliest and most untenable idea of all time. But
Yeah.
that said, I mean, Danielle Smith's not known for realistic ideas. The reality is that this is a political budget, and I'm not certain that the capital gains increase, although just, might play out politically favorably for them, because it turns it into a kind of a rich poor, and that the rich are being somehow ostracized by the liberals. And
Mm.
for years, that's been a large amount of their constituency.
Yeah, I think, well, first of all, I don't think that this is going, I agree with Finance Minister Chrystia Freeland. I don't believe that this is going to affect a large number of people. I think there may be a significant impact on, they're talking about less than 1% of all tax filers. I think that that is empirically true. And as a result, I think if you're not affected by the capital gains, um, I think you're indifferent to supportive of what the government has done. And because that is the thing. Like if my house is up for sale and the government changes the capital gains rule, so I have to pay tax on 50% of the value of the sale of my house, even if I intellectually think it's a good idea, I'm probably going to be against it, or I'm going to be pissed off, right? In that sense, I do think just the way the NDP government and clawing back here in Manitoba, clawing it back, the basic personal amount, I think is good because it helps way more people than it hurts. The NDP here also capped the property tax rebate. So you're not going to get 50% of the school taxes on your $3 million home, which ends up being tens of thousands of dollars. You're not going to get that. You're going to get $1,500. But they balanced it by the fact that if you pay at least $3,000 in education property taxes, you'll get the full $1,500 back too. So I think those things do make this tax system fair. One point I'm going to talk about Danielle Smith. So Danielle Smith's issue, it's also been raised by uh, Rob Ford in Ontario and a little bit in Quebec.
Doug Ford.
But yeah, Doug Ford, the Doug Ford in Quebec. No, yeah, it's also been raised by
Honestly,
some.
it kind of looks the same according to everybody.
Yeah, that's right. It has also been raised by some guy, in Ontario. Some people in Ontario have raised objections. No, so what this is about is the feds have housing money, but in order to get it, they are attaching conditions. And some of the premiers have objected, saying, "Well, you can't do that. You can't. This housing is a provincial responsibility, and so you can't tell us to do things like change zoning or to allow more medium to high rises or to allow multifamily dwellings in neighborhoods where there's only single family dwellings." The reason the federal government is doing that is because local government and provincial governments have been completely lame about making these changes. And these are changes that we desperately need to make. In a city like Winnipeg, no neighborhood should be protected against the construction of multifamily dwellings. We need to increase density. We need to allow for people to live closer to the center of the city in homes where they can, where they don't have to own a standalone home. They can own, a townhouse, a duplex, a condominium in a three-story, 6-unit building. And you know what? Like municipalities are completely lame as far as doing this. They fall prey to the objections of neighbors. Although in Winnipeg we're getting better, and the provincial government as well is just been like completely just a complete disappointment, and that's over multiple governments, in doing the things we need to do to modernize urban planning and for the benefit of our cities. So conditions, like, I understand that housing is a provincial responsibility, so don't take the money. You know what I mean? So don't take the money.
Also, don't get in the way.
Yeah.
That's
But don't lead follower, get the hell out of the way.
Because that's the real steps, is that the feds have stopped working with provinces who simply refuse to, and in some cases don't see in anything working with the federal government as a win, so therefore are going to stop and not play ball with anything. So even though this is a provision of the budget that's going to supposedly increase housing and supports within provinces, they're just working directly with municipalities. And I think, that what I've been trying to move us towards or think about is maybe not so much about the merits of the budget, because we've known about these for weeks.
Yeah.
This is a budget that is a pivot for the Liberals to try to key and focus upon key areas, I think, in relation to what the Conservatives are doing on issues of affordability. But I'm just interested in politically and how it's going to play out, because I think it plays into the capital gains, and then also maybe the housing money plays into a kind of narrative and a kind of story that the Conservatives are telling and winning support from, which is that the Liberals aren't worried about investment, aren't thinking about investment. They're only worried about to try to focus on taxing or spend. And I think there's some interesting things. I'd really be interested in how the next 6 to 8 months plays out when it comes to this budget. And politically, I will certainly keep an eye on, continue to talk about it as we go.
Yeah.
Now you have an assignment, because I'm off in Toronto, and I think it's a very exciting time in Manitoba because of a lot of stuff that's happening in terms of the healthcare system. There was a very interesting report released around mobile safe injection sites, around the issue of the downtown core and the mental health. And we've been sort of talking consistently about the challenges of mental health, one of the themes of our podcast. And so you have a special feature interview with the Deputy Premier of Manitoba, Health Minister Uzoma Asagwara, who is the first non-binary MLA in Manitoba history, but also formerly sports star, has a long history in the community, and has represented Union Station going back to 2019. So I look forward to your interview with Minister Asagwara.
Have you done anybody else's podcast in Winnipeg? Is this your first podcast interview?
This is my second podcast interview. My first was probably 3 years ago with some students.
Oh, okay.
That's an excellent way to start.
That's right. Well,
yes.
we are, for lack of a better term, professionals at this now.
Oh, I don't know about that.
I don't know about that.
I don't want to discredit those students.
Their audience is probably much bigger than ours. So, thank you very much for being on the podcast. I'm sorry Nigan can't be here, but he is doing God's work. Something we'll talk about in a future episode. But thanks for being here. So, right off the bat, though, like the first question that I need to ask you, and I hope it's not too personal, but do you still get a chance to play basketball anywhere? Like, are you still on the court?
First of all, thank you so much for the invitation to be here. I really do appreciate it. And I love that question. Unfortunately, no, I don't really hoop anymore. But you know what? Whenever I get asked to go and help out coaching kids in the neighborhood, maybe go help out at a practice or over the summer, I'm always more than happy to do just that.
Nice. Well, it's and it's funny because I can remember years ago having the same conversation with Kevin Chief, and and he didn't get a chance to play much basketball anymore. And it's like, I'm sure that you could pick up the ball and it would be like falling off a bike for you, absolutely. But for those who don't know, 5-year veteran of CIU, what's now CIU Sports for University of Winnipeg, All-Stars, accolades, 28 points per game in your last season. I'm going to go out on a limb too and say you had like a 32% 3-point average. So you were taking it to the paint.
I was,
is that-
that's pretty accurate.
You played close to the basket.
I did, yeah.
Okay. Well, as somebody who could neither shoot the 3-pointer or, a lot of respect. But you also did 3 years with the national team.
That's right.
And Brazil for the Pan Am Games. That must have been like awesome.
Oh, it was an incredible and life-changing experience. I had never traveled the world like that. I had, didn't necessarily grow up thinking that I would achieve something like that. It's a real privilege to represent your university or your school. It's on another level to be able to say you've represented your country. And we had such a wonderful group of athletes, and being able to compete on an international stage, meet people from all around the world who are doing the same thing that you are, or playing other sports, and making those connections has never left me. It made a huge impact on my life.
Oh, that's fantastic. Your bios everywhere are kind of short. So it's like basketball, psychiatric nurse, and politics. But let's talk about the psychiatric nurse. Like, was nursing or healthcare related profession always kind of something you were, interested in when you were going to university?
It was in university. I actually always thought I would eventually be a lawyer. And so it was really important to me to get a degree that if I decided to stop playing basketball, if that was no longer in the cards for me, that I could go into a professional career and provide for myself. And then the plan was to eventually go on to law school. But, I retired from basketball. I started working in healthcare, and I just loved it. I really did. And I saw a lot of opportunity to be a part of making healthcare a more equitable place for people. And I was fortunate to have really wonderful mentors on the front lines who encouraged me to grow my skills and to dig deep into learning. And I never found that spark again to leave and do anything else. I just really loved it a lot.
So registered psychiatric nurse, youth addictions and mental health.
That's right.
So that is a somewhat honed niche of the nursing profession. Why mental health and addictions?
Mental health, as a student, when I was learning about it, I realized how little I knew. I realized how I'd spent basically my entire life never talking about mental health. I grew up in a household and as a part of communities where we didn't discuss mental health issues. And there was a lot of stigma still at the time around mental health. And I thought that was a problem. And so I was really, really invested in learning how to be a part of making mental health care just a normalized part of healthcare, right? And it's something that when I got into it and started to understand just how expansive it was, addictions and co-occurring disorders is an area that I really leaned into. So how do addictions and mental health and trauma and adverse childhood experiences, how do those things speak to each other, was an area that I just became really fascinated with. And especially as it pertains to youth. Kids so often don't have the language for what they're experiencing, and it's important that adults have the tools to provide them the support that they need and deserve. And so it was just a really important area for me personally and professionally, lots of opportunity to learn and grow.
So where exactly did you work? Like once you were out of school, where did you get a chance to apply your profession?
You know what? My first job as a psychiatric nurse was out at Selkirk Mental Health Center.
Wow.
And so I was, done basketball. I had this great resume, I thought, and lots of expertise in terms of being in community and experiences. And Selkirk was a place that was rural. Everybody wanted to work in the city. They wanted to work in the acute settings that were really appealing, but they were the ones who gave me a shot. They interviewed me. They thought that I had the right skill set, and I didn't even have a vehicle, to be honest. I had to go out and buy my first car, and that was a whole experience for me, and doing all of these things kind of on my own in ways. And I went out there. I took the Greyhound bus to my interview and got there really early and had to kind of sit around in town. And from there, they just, working at Selkirk Mental Health Center, working in the Interlake was a really important part of my path because it really reflected the value of community and people working together and, gave me a wide range of access to experiences and training that
Right.
made all the difference for me as a new nurse.
Also, large institution, fairly traditional way of
Yeah.
dealing with mental health. I mean, were your experiences working within a large traditional institution? How does that affect your outlook now?
You know what? The thing about it was I didn't realize as a new grad how much amazing progressive work was being done at that center, at that hospital. They had a new acquired brain injury program. I didn't really know much about acquired brain injury beyond what I learned in maybe a course in university. And that was actually one of the first units I started on. And so I was introduced to this other way of looking at mental health, brain injury, working with families. And I also had access to acute care, forensic care, geriatric care, community care, co-occurring disorders. And they encouraged me learning and training in all of these areas as much as I could. And so, my lived experiences also factored into how I did my job. And I was working in a place where at the time there wasn't really a ton of diversity, to be honest, but the managers and team members I had were incredibly receptive to just learning about people, right? And listening to feedback. And I still cherish the relationships with colleagues I had at that time, the mentors I had who remain mentors and friends to this day.
So I'm going to circle back to, the decision to go into politics, which, is its own, there's kind of a pathology that everybody sort of goes through a different experience when they've got a great career and then politics. But so, I think we've all spent time in jobs, where it's party to, being a working person, sitting around going like, this is wrong and that's wrong, whatever. And you know what? If I was only in charge, think of the great changes I could make. So did you start dreaming of becoming health minister early in your life?
Never.
Yeah.
Oh my gosh. Never. Not a chance. I never, not one time, thought about myself being a politician or a legislator in any way, shape, or form growing up. I think about the fact that there weren't Black people elected to the provincial legislature until 2019 when myself and two others were elected, Jamie Moses and Audrey Gordon. And I'm sure that there was a part of my journey where I didn't see anybody elected who looked like me. And so why would I consider that being a path that I could pursue? But ultimately, the decision to go into politics was, for me anyhow, rooted in, is there another way that we, as in myself and community, can be part of making a difference, right? I think I was very lucky from a young age to be on the path of service, always volunteered, always had the desire to be in roles where I could be helpful or useful. And politics seemed like a place where you could work with like-minded people who care about important things and move things in a direction that helps people. And that to me is a rare opportunity, but if you have the chance to go for it and do that alongside some good folks who care, then why not pursue that?
So I know, and I could be completely wrong, but I don't think that you were particularly active within any political party earlier in your life, which means you were recruited into the idea of becoming a candidate. So, I mean, really, somebody comes up to you and says, hey, I know you've got this great job, and you're making a difference, and we'd like you to set that aside and put yourself into the ultimate popularity contest, which unfortunately, that's how it starts. So how do you make a decision, because I can imagine somebody with your credentials being recruited to work as a senior person in a bureaucracy or, a policy side. How did someone convince you to get to the electoral side of the equation?
Well, initially I said no. When I was asked, I said
even if you do
nope.
it, you should say no the first time.
And then I paused and thought about why was it that my immediate response was no? Like, what do I even really know about this job, this opportunity, right? What is this role really in the weeds of the details look like? And I took a step back and I thought about all of those details and I got a bit more information about it and I had more conversations. And the first time it was actually presented as a real opportunity was for the 2016 election.
Right.
And my answer at the end of the day was still no. I was doing a lot of work in community. I was really, really invested in making a difference on the front lines in healthcare. And it didn't seem like a path that I wanted to go down at that time. And then the 2016 election happened. Working on the front lines in healthcare, it was pretty quickly felt the impacts of a change in government and the culture change in government. Just seeing the impacts of that in the ways that I was able or not able then to provide care, to me was untenable. You know, I had a hard time with not only what was happening here in Manitoba, but certainly there are big changes in the United States. And that was felt here in our province. And so by the time 2019 came around, I had thought deeply about whether or not I could make a difference in a new way. Like, could I take all of this energy that's out in community organizing and advocating and in the system of healthcare, and can I put that energy into a new role and move healthcare and help move our communities in a direction that doesn't leave people behind? And so that was at the heart of what 2019's decision was.
So, okay, so we're going to do a fast forward through the opposition years.
Yeah.
Gary Dewar used to say a single day in government is like 100 times better than a lifetime in opposition, or some version of that. But the 2023 election, you've won, you're immediately identified as somebody going to cabinet. At some point, you have a meeting with Wob and the premier, I should say. Sorry, he is a friend of the podcast.
We had this conversation before. It's what are we supposed to call the premier?
No, I mean, thankfully he doesn't mind if we say Wob. So you have a conversation with the premier, and he says health minister, and so that is like within political circles, I'm sure you know, that is considered it's the most important job. A lot of people think in cabinet. It's the largest budget. It's also considered to be the quickest way to get out of a career in politics, because the chances for people to see you as doing something wrong seem to be so much more than the opportunities you get to be seen to do somebody right. So, but I'm assuming when he asked you, you said yes the first time.
I did.
Yeah. Okay.
Yeah, I definitely did.
Yeah.
Yes.
So what does it feel like to be the person in charge of the biggest budget department in government?
It's when the premier said that this was what he would like to see, and extended that opportunity, it's a really humbling moment, right? It is. I have a tremendous amount of respect for him. I know how deeply he cares for people, and the weight of the responsibility he carries for leading this province in a good way. And so being presented with the opportunity to serve in the role as minister is something that I do not take lightly, and I didn't take lightly when he asked. I said yes right away, and my focus in this role is to serve in the best way possible. It's to wake up every day and go to bed every night focused on how I can make a difference and move healthcare in a better direction for the people of this province. And I think it's important to note that I'm not doing that alone. We've got a great team of people at the cabinet table. We've got a great caucus of new and energized MLAs. The civil service is full of the most brilliant and kind-hearted people you can imagine. I just met with a bunch of folks who've been working really hard to clear the health card backlog and have done it. And, these are people who are focused on making life better for people. Mm-hmm. All across the province, there's people who are focused on making life better for people in healthcare. And so when I step back from the role and me as an individual, and I focus on building relationships and focus on what is it we can achieve together. And I think a big part of that ties back to me being an athlete and being a team-based athlete, where you're only as strong as the person to your left and to your right. And you want to make sure that as a team, you're as rock solid as you can be to achieve something bigger than yourself, right, bigger than your team. And so that approach is fundamental to how we get this job done. But certainly it's, there's a lot of real challenges in healthcare. And it requires a daily focus and recommitment to doing this work in a way that puts people first.
So it's almost impossible for me to pick just one thing to talk about, because it certainly in again, please disagree with me if you think this is wrong, but like you almost need like 12 arms to kind of deal with all of the things that have come up. I mean, there are the big macro things, and we will talk about wait times, ER wait times, and diagnostic and surgical wait times. Well, and let's just start with that. So, the situation was bad when you inherited government. And I think that, 7 months in now, we can certainly see that, there hasn't been a lot of positive movement, in wait times in general. So I guess the question I would ask you though is, what is a reasonable amount of time? Like if you can tell me, and I will diarize it, and then we'll come back in whatever period of time you want to talk. And, we can then say, okay, well, this was the roughly the time when you thought the public could see some real, so if it's not 7 months, and I agree, that's a pretty small sample size, how much longer before we start to see some meaningful movement and, the needle moving in the right direction?
That's a really fair question. It's a question that I hear from folks on a pretty regular basis.
I bet.
Out in the communities, right? The reality of where we are in healthcare is that we didn't get here overnight. It took years of intentional cutting of healthcare, closing emergency rooms. And when we talk about those things, they seem very macro, right? Cutting healthcare, closing emergency rooms. But what that actually means on the ground, closing emergency rooms, cutting jobs, forcing people out of the careers that they love, away from what they've trained to do and have done for years and developed expertise around, and said, go figure out what you're doing next somewhere else. It's, cutting healthcare and cutting 500 beds across the system. Those are all folks who have a very particular set of skills and expertise that you've now said, go somewhere else and figure that out. And you do not repair that, and you do not even necessarily stabilize that overnight in 7 months. What you can do is what we've been doing, which is every single day show up, listen to the same people who were told for 7.5 years their voices didn't matter. Listen to their expertise, value what they have to say, start doing the work of rebuilding trust and repairing that relationship. Show up and listen even when it's hard, even when it's not necessarily what you thought you were going to hear. Take that feedback away, have it inform the decisions that you make. Invest in capacity in our own province. Invest in capacity in services that are going to help the front lines. Are we going to see the benefits of that right away in a month or 2 or 3? Not necessarily. But what we are going to see is some morale being lifted. What we are going to see are some pressures being alleviated in ways that allow for people to maybe take a lunch break or discharge a patient a day or two earlier than what they would have been able to previously. And so we are starting to see the impacts of the investments that we're making, decisions that are being made, and the capacity that we're adding to the system. Being able to meet with students and healthcare workers who are practicing alike in our listening tours has been outstanding. Students being able to see that they have a premier and a government who actually cares about them and is showing up to hear what they have to say, and reassuring them that there are jobs right here in Manitoba. The premier, I'm sure you've seen this, will stand in front of students and folks and say, please, put his hands together and say, please, please, please stay in Manitoba. And, we're all doing that. We're encouraging people to remain here in their own province. And I think for the first time in a long time, people are feeling hopeful that they can do that and that their government actually has their back. So I think in terms of a realistic timeline, it's important for us to take a look at broadly how things are people are feeling. So anecdotally, it's important for us to be able to look at, okay, now we have 7-day-a-week discharge, right? We made an investment so that if you have your knee replaced, or if you are, you were injured and you got care in a hospital and you're getting physiotherapy or occupational therapy, Friday at 4:00, the occupational therapist doesn't need to just check out for the weekend and you're stuck there with nobody providing that care on the weekend. right? We've invested so that you can get that care on a Saturday and a Sunday and go home to recover instead of waiting until next week. Exactly, right? So we're doing things that are improving capacity, and we're starting to see the benefits of that. But in terms of when we're going to really see it in larger ways on a bigger scale, it's going to take us time. It's just going to take us time.
Would you say fairly that it might be measured in years? And when I say years, I don't maybe mean 3 or 4 years, but at least 1 year, maybe 2 years to see meaningful changes.
For sure. I do think that fairly, that's the reality. You know, when we say to folks, we didn't get here overnight, it won't get fixed overnight. It did take years to break the system down to a point where basic functions are not happening. And it's going to take us years to meaningfully move things in healthcare in a direction where folks can feel very confident. We're going to keep trending in the right direction. And, you know, we're no longer seeing these exorbitant hours of overtime and mandating and all of that. It's going to take us years, right? But we will get there if we keep taking the right steps every single day. We're going to get there.
So I've had an interesting conversation with a number of people in your government about the 1,000 additional healthcare workers within a year, which is, you know, it's bold, you know, it's aggressive, but the urgency of it seems to make sense when you look at how bodies, you need extra hands, you know, maybe you need sensible shoes on the street, as they say. But, you know, I think within that, I have expressed some concern that 1,000 healthcare workers is going to become this NDP government's version of ending hallway medicine, which was the weird kind of unfinished pledge of the 99 dour New Democrats. But I'm gonna sort of dig into that 1,000. Okay, so. And I'm not just pandering to the guest, I promise. But everybody in healthcare, every professional, non-professional is important. But the system runs on nurses. Really, it's so clear to me, both through my work as a journalist, but also having family members in the healthcare system, that the system really functions or doesn't function based on nurses. This province, other provinces too, have seen all kinds of nurses, hundreds, maybe thousands of nurses leave the public system to work in the private system and then get cycled back into the public system as contract nursing at a much higher cost. It would seem to me to be maybe the best metric you could use about the new culture of listening is if you can start to show that there are people coming back from the private sector. So I know you've been out meeting with people and talking. Do you know of anybody that you've been able to convince to give up their private sector agency work to come back to the public system? Do you see that as that's a ready to made, reservoir of talent to bring back into the system? Where is your relationship with the nurses working in the private sector?
That's a really, really great question. And the way you framed it, the short answer is yes. The long answer is we have so much more work to do in order to really ramp up those numbers, which is why this budget 2024 is so important. Our budget is making strategic investments, some of which to some people may not seem that significant, but it's about investing in ways that are smart, and it's about focusing on improving capacity and investing in what nurses are saying they need. Nurses need better work-life balance. They need more flexibility. They need structure that provides them, collegial support and mentorship and takes work off their plate, quite frankly, just lets them go out and do what they do best, which is provide care at the bedside. And it's why we've invested in enhancing and expanding the nursing float pool. The original call for that, when they, first were doing intakes for that, I'll say, they had hundreds of nurses who were interested, but they didn't have the capacity to do the work to get those nurses into the system, right?
The administrative capacity.
Exactly, right? And we are investing to make sure that if you are a nurse working in the private for-profit agency system anywhere, and you want to work in the public system, you will be able to join our float pool, the nurses, the provincial float pool rather, with ease. We're going to make it timely. We're going to make it easy. You're going to have the supports that you need. You're going to have the flexibility you deserve.
Just for people who don't understand the float pool, but the idea of it, which was, came up in collaboration with the Manitoba Nurses Union and others, is to kind of create a public working experience that mirrors
exactly
the private, where, the private agency nurses are working at place A on day one, and then maybe for 3 days they're there, and then they're moving somewhere else, and they get per diems and mileage and other benefits for doing that. So the provincial governments or the public systems, that is an attempt to create that experience.
That's exactly it. And the Manitoba Nurses Union did a great job understanding what nurses need and developing a float pool in conjunction with partners that makes sense for nurses. And nurses want flexibility. They want to pick up shifts where it's comfortable for them, where they maybe want to learn a new set of skills or be in a rural community. And this float pool allows them that flexibility. It allows them the experience. It makes sure that they're still getting the benefits they deserve, right? It's checking all the boxes that nurses are looking to get checked when they go private. And so investing in expanding that, allowing for part-time roles was huge. Nurses were saying that we want part-time opportunities through this float pool. So we invested in making that happen. And we're going to keep doing that. We're going to keep growing the float pool and taking other steps as well. Changing the culture in healthcare is a big part of that. I hear from nurses all the time that, they would work in the public system. Yes, our government has changed. That's given them hope, but we need to do a lot of work so that their environments on the front lines are healthier and where they want to be. And we're doing that work with them.
So are you sort of concerned, and this goes back to the 99 and ending hallway medicine, the government back in the day made huge strides in alleviating the vast majority of hallway medicine, but it was never eliminated. And I think the punchline of that thing was it's not supposed to be 100% eliminated, because there are times where you need people to be in an ER to be observed, but you don't need to admit them to hospital. So the hallway sometimes is, the best solution. So do you have any concerns though that you're going to get to 835 at the end of the year and have to suffer slings and arrows for the 165 that you didn't find? Like it's, the premier has said that he thinks that you're going to get beyond 1,000. I'm sure there were a lot of people in Manitoba Health that were great that the premier thinks we're going to go beyond 1,000. Thanks, man. But seriously, you're worried about coming a little bit short and that becoming the story and not the fact that you've got 800 more healthcare workers? Not at all.
Not at all. The 1,000 healthcare worker target is very ambitious. But Manitobans deserve an ambitious government. They deserve a government that is willing to match the commitment of frontline healthcare workers. They deserve a government who is willing to step up the way that others have stepped up in our healthcare system for years. And so us setting that target, it's ambitious, it's bold, it's achievable. It's going to require an all hands on deck approach. It's going to require us, taking an approach to healthcare that we haven't seen in a long time. But that's the approach that Manitobans deserve. They deserve to see their government not fighting with doctors, but instead standing with them to announce how we're going to get this done together. They deserve a government who goes to the front line to meet with nurses and healthcare workers instead of accusing nurses of absolutely ridiculous things like we've seen under the previous government. And we're going to continue to listen to allied healthcare workers, allied healthcare professionals rather, support staff in healthcare settings. Everybody's voice in healthcare matters. And what I learned very early on in my nursing career was that when you value folks, no matter where they are in the healthcare system as a part of the healthcare team, you'd be surprised how much you can learn about where you can make small investments with big impacts, about where you're not seeing something for what it is when you need to make the right change or decision. And that's an approach that we're committed to taking because it's what healthcare workers have told us very plainly is the approach that's needed.
So everybody that comes into an important job like this, I think, reaches a couple of moments early on where the idea that I never thought I would be the person to say or do X. So, and I'm not making light of any of this stuff, but pepper gel in hospitals. Okay. So, again, for the benefit of listeners, there's been a lot of talk about how to make hospital setting safer for staff and for patients. Hospitals right now have an enormous problem with a lot of volatility, a lot of violence, and it's taking its toll on the staff. It makes it harder to get healthcare professionals and others to work in some of the emergency rooms, for example. So the Manitoba Nurses Union asked for it, and very quickly you responded that security staff, newly trained and equipped security staff, will at some point have pepper gel and batons.
Pepper gel.
Pepper gel. So this is not just controversial in Manitoba, it's controversial everywhere. I mean, in the United States, the discussion is about whether to give security firearms. Thankfully, we're not there. But so, A, how do you feel about making that decision? And B, you really seemed, I mean, I know that there's probably a lot of deliberation behind the scenes, but you came to the decision very quickly. The arbiter did not recommend out of the grievance that this be done, but you decided that we should. So why? And why move so quickly? Because it seems to be a fairly complex, equation.
I have been meeting since my first week in this role very regularly with healthcare leadership, with folks who have been dealing with the increased challenges around safety and security. And it is so important that no matter where you work, that you're safe at your job. Everybody deserves to go to work every day and know that they are going to be safe and secure. Healthcare workers deserve that as well. And patients deserve that. Patients deserve to go to an emergency room or an urgent care and trust that the environment is safe and secure for them. For several years under the previous government, there was little to no action taken. I was shocked, full transparency, shocked to find out that institutional safety officers, there was never a plan for them to be introduced to HSC or any site across the province. No plan.
Yep.
Which to me, it was the law has been passed years ago. And to find out that no steps have been taken, no direction given from the health minister's office to just get these folks in place, given all of the safety concerns we hear about on a regular basis, to me was unconscionable. And so very quickly made a plan with folks and gave very clear direction that we needed an aggressive timeline to get institutional safety officers trained and on site at HSC and across the province. The arbitrator's report did not provide direction in terms of what the ISOs were to carry in terms of equipment. And yes, I gave that direction because it's been made very clear to me that these folks having the equipment, first and foremost, the training and the skill set to de-escalate escalated situations, to approach situations with care and understanding of mental health, of addictions, to have a culturally aware approach to how they, safely and create safety and security on sites is key. But to also have the equipment available to them should a situation be beyond what all of their de-escalation skills, et cetera, training provide. It's a last resort. And I think that's really important to talk about. This is not something that we expect or anticipate to be used regularly or to be dispensed in a way that isn't in a last resort situation. And my priority is continuing to take steps to implement safety and security measures that keep staff and patients safe. In a perfect world, down the road, we don't need those measures.
Yeah.
If we do all the work right, if we have the capacity we need in the system, we're staffed up well, patients have access to the services they need, mental health wise, addictions wise, in the right places, our wait times are way down, all the conditions being what we hope and need them to be, sooner than later, then we look at things differently. But for right now, my priority is making sure I'm listening to these staff and patients and we're implementing measures that keep them safe and secure.
So when you were working as a registered psychiatric nurse, if you can imagine, perhaps being in a hospital setting or ER setting, would the Uzoma then be comfortable having guards with a weapon like pepper gel there to, because you probably know better than anybody about crisis intervention and de-escalation. I think it is the thing that I found curious about it is just the idea, though, that hospitals are crowded settings.
Mm-hmm.
They are, the hallways aren't really wide. The rooms are small. Even a tool like pepper gel, which doesn't create a plume and many contamination problems, it seems like maybe a necessary, but possibly also controversial way to handle it. Would the registered psychiatric nurse you have been comfortable having that while you were working?
The registered psychiatric me from day one as a nurse and my colleagues and managers, etc., always prioritize safety. It is so important because you can't receive care if you don't feel safe and if you're not safe. And you can't provide the best care possible if you don't feel safe and if you're not safe. And safety means different things to different people. We know that. But fundamentally, a safe and secure environment allows for a lot of those stressors to come down.
Mm-hmm.
And a culture of safety and security and knowing and trusting that the environment that you're providing care in or you're receiving care in is prioritizing safety allows for people to relax a little bit and let those walls down. And, as a nurse, especially as a new nurse, you're nervous, you don't know all the things you thought you knew when you get onto the job and onto the unit. And having people around you who are prioritizing keeping you safe, first and foremost, prioritizing keeping the patient safe is key. Having protocols in place. When I first started, we do have security guards. We have codes, we have protocols. If you need help, people are there for you.
Mm-hmm.
And so fundamentally, I understand the importance of being able to work in a safe environment and being able to provide care in a safe environment and see patients respond to knowing that they're safe and what that allows for them to do and participate and disclose and all of that when they're receiving care. And so when I hear on a regular basis from nurses that they are not only not feeling safe, but that they are not safe, I am compelled to take action and work with their leaders. Again, I talk with these folks on a regular basis and work with the experts who quite frankly know better than I do when it comes to implementing safety and security measures so that we can create environments where patients have the best chance at a good outcome and healthcare workers can put their best foot forward in terms of providing care.
In terms of a practice in Manitoba hospitals now, I did fairly exhaustive research. I couldn't find a lot of research data or case study data on what the introduction of things like this have meant to hospitals. The arbitrator made mention of the fact that she could not recommend this because there wasn't enough evidence. So to a certain extent, is there a bit of a leap of faith on your part and the healthcare system's part to introduce this, realizing that we don't really 100% know what impact it's going to have? Like, we know what our intentions are, but they're just, and my apologies if there are social scientists out there sitting on top of a fantastic study. My email is beneath my column. Like, please send it in. I couldn't find anything conclusive. So is this a bit of a leap of faith?
This is part of an approach to take steps that improve safety and security, not only at Health Sciences Center, but at sites across the province. What we know is that what was happening wasn't working. What we know is that for 7.5 years, steps were not taken, actions were not taken, staff were not listened to, patients were not heard. And as a result, our emergency rooms, urgent cares in different settings were increasingly unsafe. And we're seeing rates of violence that we've not seen before in healthcare. And it's also important for folks to know that it's not just about institutional safety officers, and it's not just about pepper gel. it's about staffing. It's about adding people in these settings, decreasing vacancy rates. It's about making sure that we are improving bed flow so that we don't have, so many folks waiting in emergency rooms. It's about improving access to primary care so that people aren't in distress and going to ERs for things that they should be seeing their doctor for. It's about investing in many ways throughout the system to make sure that emergency departments are dealing with emergency issues and that there aren't pressures placed on those folks in those settings that end up being environments where we see these incidents increase. And so improving safety and security measures with institutional safety officers and other steps that we will be taking is part of a larger plan and approach to healthcare that is about improving capacity, decreasing those pressures, and improving the experience, the patient experience, and the healthcare worker experience across the board. And so I know it's easy for us to focus on that, and I understand why, but it's important to see it within the context of all of the steps that we're taking and the work that's being done.
So I think that, this discussion about safety in the hospitals dovetails quite nicely with the issue of mental health and crisis intervention and safety outside hospitals as well. So we've had, and we've done on the podcast, we've had some fascinating discussions about the best way to intervene in mental health crises. We're test driving programs like ARC right now. And there has been a discussion about whether there should be more involvement of mental health professionals along with police at the first point of contact. And, right now, the way the Mental Health Act is written, it can only be a police officer. There's no description of how they should intervene. So police are allowed to set their own policy. I know it's been difficult to find the people to work in those integrated teams. Do you have some sort of a vision or a goal that you would like to see the government work towards? And is it possible that it could involve some, possibly an amendment to the Mental Health Act to allow for, right now, if there's an order under the Mental Health Act, the police are the only people who can respond. And a lot of people in the mental health community think that's a problem. Where do you see things going? Where do you think government could play a role in all this?
Such an important question. I having worked in mental health and acute mental health settings and long-term mental health settings, worked with youth and adults. Certainly, I have seen the Mental Health Act actioned in many, many ways, shapes, and forms. Our government, this budget, again, super important. It's making investments that are going to help have a more appropriate response on the front lines of healthcare, including mental health care. And so hiring 25 additional mental health workers is key. I do think that all options have to be on the table in terms of how we approach mental health workers' roles, in terms of the way we want to structure some of these responses, these coordinated responses. And it has to involve community. It has to involve the experts, but it also should involve the community. There's a lot of expertise in community that, again, has been lived experience, folks who understand crisis intervention and de-escalation in a way that, training just can't provide you. And we have to value that expertise. And it's incredible to be in this role and meet with people who have been eager to share their expertise and information and have just never received an invitation, right? And they have a ton of great data, a ton of great information to share. They have been doing things, I give credit to an organization like Mount Carmel Clinic. I met with them the other day, and Aboriginal Health and Wellness. Great leaders, just so engaged with community. They've utilized programs like the Community Safety Host Program. They've been doing that for a decade. I didn't know that. They've been knowing how successful and impactful that program is. And so when we're talking about safety and security measures and responding to mental health crisis and all of that, we have to look at programs that meet people where they're at. We have to talk about expertise that maybe is outside of the box of what we think medically always has to be valued at the highest level. Formal education, all of that is so important, super key. We want more of that in our system. We also have elders, knowledge keepers, peer support workers, and people on the front lines who are doing life-saving care every single day. And their voices have to be a part of the conversation, and their expertise needs to be a part of the solutions.
So we're sort of in a transitional period right now where we are trying to introduce new resources. But, as mentioned before, the basic rules of engagement are the same. As soon as things get a little hanky, it's automatically the default is over to the police. And that is really kind of the protocol that's outlined in the Mental Health Act. So do we need to modernize? We obviously need to modernize our thinking. Do we also need to modernize the legislation so that it's quite clear that the way we've done things doesn't necessarily have to be the way we do things in the future?
Well, I definitely think first I want to give a shout out to my colleague, Minister Bernadette Smith, who is just doing an incredible job on the housing, addictions, and homelessness and mental health file.
Right.
Her and her team are working super hard, and she has a lot of community experience on this front as well. And what I would say is that we as a government are a listening government. We are listening to community partners. We are working with community agencies. We are working with the police. We are working with, again, community orgs, health providers, mental health providers, those with lived experiences, to develop approaches and strategies that are actually going to make an impact, right? And so those relationships are so important, and all of the options and ideas have to be on the table, because again, what's been done the past many years hasn't been what's been needed to meet the needs of Manitobans in the best way. And so we have to do things differently. Our government is committed to taking approaches that put people first and really values the experts across the healthcare and mental health care system who, again, are super eager to just be engaged, to be invited to the table and be a part of the conversation and have their ideas taken seriously. And so the meetings that I've been a part of, the meetings that I've had, the spaces I've been welcomed into as a minister have been really, really rewarding. And I've learned a ton. I thought I knew some stuff before coming into this role, and I can't tell you I've learned so much more. I've learned a great deal being in this role. And that's what you get from folks when you extend the invitation. And I have to also say thank you to people for being so receptive to our government, because trust was broken for a lot of people for a number of years. And I think a lot of people got to a point where they're feeling a little bit hopeless. And to decide to trust a government again, to decide to trust ministers, to value your voice, takes courage when you've been disappointed so many times over so many years. And so I thank those folks, and I value the relationships we're building with them.
Minister, thank you very much for your time. It was great talking to you about all the myriad of things that you're trying to address. It is actually some of the big macro problems. It's going to take some time before we can assess the efficacy of what the government is doing. But certainly you guys are showing an interest in a lot of the other important collateral issues too. So, it'll be interesting to see where it all goes. And, with a little bit of luck, you'll come back, and talk more about it. It won't be like jumping out of the airplane a second time. But thank you very much for being here.
Thank you so much for having me. Yeah, I really appreciate the opportunity, and I do look forward to coming back, jumping out a second time.
Thanks to everybody who has worked with the podcast, the leadership of the Winnipeg Free Press, Adam Glynn and the good folks of CJNU. And if you like it, tell your friends. If you like the podcast, tell your friends. Thank you very much, everybody.
Like and subscribe, I think, is what they say these days.
Yeah,
that's the modern parlance.
That's right. We don't want just the thumbs up. Thank you very much, and we'll see you again real soon.